Do you have a toxic landfill in your mouth? Do you have heavy metals that are poisoning your system or creating a battery? Now, I'm not a dentist, I'm not an oral surgeon. I just see people all the time that respond well to getting the mercury amalgam fillings out, and here's why. Do you have a toxic landfill in your mouth? Well, you might if you have any silver fillings, and that's something that I get asked all the time. Do you think mercury or do you think silver fillings are good for you? Should I take them out? And the answer is no. They're not good for you, and yes, you should have them taken out. I'm not a dentist. I'm not an oral surgeon. I just have some personal experience and something that I've seen for tons and tons of patients that come in the office have chronic disease problems. And I will say this, by and large, most of them get better. Some of them substantially get better, but I will also say that some don't. So I don't want to put in anybody's head that if they do this, they'll automatically get better. But man, do I see a lot of people get better. And then there's my own case, and then what happened to my father. So one of the reasons that we do vitamin infusions in the office was because of my dad's story. My dad had an old tooth with some mercury underneath it, had a crown over on top of it, basically bit down on a walnut. The crown came, disintegrated. He got some of the mercury into his system. Now, we didn't know at the time that damaging effect that would have, but it was horrible. He developed a severe case of Crohn's disease. His liver enzymes went off the charts. His eyes swelled shut. He got these huge plaques and lesions on the extensor surfaces of his body. Just horrible. We took him to 13 different medical specialists, and to their credit, the medical specialists said, "We don't know what's wrong, but we know it's really serious." We got our family together twice thinking he was going to pass away. And I was at a medical conference in Kansas City, Missouri, and a doctor who I was workshopping different conditions with, I asked him about my father's health, and he said, "Jason, your dad has mercury toxicity. He's got gastrointestinal scurvy. It's probably coming from a bad tooth." And when the doctor told me that, I literally, it was all I could do to not roll my eyes. I'd been through college. I'd been through a doctoral program. Anyway, and I just thought if this was a problem, someone would have told me about it. But sure enough, what we did is we took my dad to a biologic dentist. He got enormously better, almost immediately taking it out. We did some IV vitamin C infusion therapy, some glutathione, some alpha-lipoic acid, some CoQ10, some cilantro, some milk thistle, all those things to help detoxify the body. He went from death's door to back to work, and in 2 weeks worked another 10 years before he passed away from natural causes of something else. But I learned a tremendous amount about that. My own situation where I actually had a bad root canal, which I don't think root canals are good either, that caused an infection or some osteonecrosis of the body, gave me a horrible skin condition. I got that tooth extracted. When they pulled the tooth that had the root canal in it, it smelled so bad. I turned to the dental assistant and I said, "I'm really sorry. You need to go brush your teeth." And she chuckled for a minute and she said, "That's not me, that's you. That's all the infection coming out." And I'm not telling you to gross out. I'm just saying that dental health has an enormous effect on people's health. Matter of fact, with any chronic condition, one of the things I always ask about, do you have silver fillings? Do you have gold fillings? If you have different metals in your mouth, it's in my opinion, you can actually set up a battery because you have one metal over here, one metal over here, run a current through there, it crosses the meridian, it throws all your acupuncture meridians off. And the silver mercury fillings I don't think are good. But here's something that I want to talk about that's really important. If you are to get those removed, please get them removed in the right way. Now, I'm not a dental expert, so I can't tell you all of the things that go associated with that. I do know you want a dental dam. I do know you want a respirator, you want to clear it. You want some type of fan or evacuation system to pull all the fumes out, because I've had patients go in and have their dentist just pull those out and they get really, really ill. So a couple things that we wanted to go over as far as a mercury and why it's so difficult for you. So mercury is a very, very potent neurotoxin. There's something that comes off teeth called mercury vapor. And there's different YouTube videos that if you'll do a search engine for that, and you'll see this toxic fume coming off of teeth. And it's very, very detrimental and damaging to nervous tissue. Matter of fact, there's really only two places that the EPA, our Environmental Protection Agency, allows for mercury. One is in some type of specially contained toxic landfill, or two, in your mouth. Now, I know that sounds crazy, but really that's what it is. We know that mercury is extremely damaging to the nerve tissue. And if you couple that with a chronic infection or a root canal, I just think it's a recipe for disaster. So when people ask me, should I get them taken out? The answer is yes, I think you should get them taken out, but get them taken out in the right way. You know, it's interesting that the United States lags behind everybody else when it comes to amalgam and mercury toxicity. It's been banned in most other countries, and I think there's political pressure from different trade organizations to allow the practice to continue. But if you are going in for a filling or a cavity, I recommend that you do some type of composite or clear filling, and I don't know all the terminology, but please stay away from mercury fillings. I think they're horrible for your health. It's interesting because despite it being banned and everywhere else, about 70 to 80% of dentists still use mercury, still use those amalgam fillings, even though we know it's toxic, there's not a safe place for it. And probably as strongly as I feel that you should get them out, there's dentists out there saying, you know what, it's totally safe, I've been doing it for years or decades without any side effects. I can only tell you what my patients are telling me when they're coming in the office. I've seen rheumatoid arthritis go away, I've seen MS go away, I've seen different types of cancer clear up, all when people get a dental revision and get the bad toxins out of their system, they do much better. Now, there's a lot of financial factors associated with mercury and amalgams. I think that is really what is driving the continued use of this, because we know that this is a very, very toxic metal. And really when you determine the effect that it has on health and the environmental impact that mercury has, it's probably the most expensive thing that we can do to destroy health and to contaminate the environment. There is some supportive therapy when you do have a dental revision or you get your mercury fillings taken out, and again, they need to be taken out the right way. And the first thing that we need to do is to make sure that your detox pathways are working correctly. Let's get a complete metabolic panel. Let's check your liver enzymes and your trace minerals and your kidney function. And then we want to preload the body with some antioxidants. We want to make sure that there's CoQ10, alpha-lipoic, vitamin C inside of the system before you go and get these taken out. Cilantro works really well, Spanish black radish, and some things that are mild heavy metal chelators. There's a really neat product from Nature's NX called Complete Mineral Chelates, and there's some oral EDTA chelators that are available. I also like Bottled Sunshine, which is your vitamin A, D, E, and K, which act as mild chelators. But fairly high dose levels of liposomal vitamin C will really help to protect your body as much as it can when you get those mercury fillings taken out. This is Dr. Jason West, and this is my opinion on amalgam fillings and amalgam films removal. Hey, thanks for watching the video on mercury fillings. It's a topic near and dear to my heart. I've seen amazing outcomes when people get the toxins out of their mouth and have a dental revision. If there was a value, please like us, and we'll see you on the next video.